Erenumab is a calcitonin-gene-related peptide antagonist used to prevent migraines. In this video, let's find. What is Erenumab? What is Erenumab used for? Contraindication. What are the side effects of taking Erenumab? How does Erenumab work? How to use Erenumab? What is Erenumab? Erenumab, sold under the brand name Aimovig, is a medication which targets the calcitonin-gene-related peptide receptor for the prevention of migraine. It is administered by subcutaneous injection. Erenumab, which was developed by Amgen and Novartis, was approved in May 2018, and was the first CGRP antagonist to be approved by the U.S. Food and Drug Administration. In 2020, it was the 234th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is Erenumab used for? Erenumab is indicated for the preventative treatment of migraine in adults. Contraindication. Contraindications. Hypersensitivity to drug or excipients. Cautions. Hypersensitivity reactions, e.g., rash, angioedema, anaphylaxis, reported, may occur within hours or 1 week following administration. Discontinue administration and initiate appropriate therapy if serious reaction occurs. Hypertension. Side effects. Common side effects are constipation, pruritus, muscle spasms, as well as mild and mostly transient reactions at the injection site. Pharmacodynamic. As a human monoclonal antibody designed to specifically bind with and antagonize the calcitonin-gene-related peptide, CGRP, receptor, there is the possibility that Erenumab could interfere with natural activities of CGRP that may not be immediately or directly associated with migraines. For example, at peripheral synapses, CGRP released from trigeminal terminals results in vasodilation by way of CGRP receptor on smooth muscle cells of meningeal and cerebral blood vessels, making CGRP a potent general arterial vasodilator. Antagonism of CGRP receptors responsible for vasodilation could theoretically result in vasoconstriction and raise blood pressure. Mechanism of action. Erenumab is a human monoclonal antibody that has been designed to bind specifically to the calcitonin-gene-related peptide, CGRP, receptor and antagonize the CGRP receptor function. CGRP and its receptor are expressed in both the peripheral and the central nervous system. In addition to playing a role in cranial nociception, CGRP is also a potent general arterial vasodilator. At peripheral synapses, CGRP released from trigeminal terminals results in vasodilation via CGRP receptors on the smooth muscle cells of meningeal and cerebral blood vessels. Half-life. The effective half-life of Erenumab was observed to be 28 days. Dose. Migraine prophylaxis. Indicated for preventive treatment of migraines. 70 mg SC once monthly. Some patients may need 140 mg SC once monthly, administered as 2 consecutive 70 mg SC doses. Safety advice. AUTGA pregnancy category B1, drugs, which have been taken by only a limited number of pregnant women and women of childbearing age, without an increase in the frequency of malformation or other direct or indirect harmful effects on the human fetus having been observed. Studies in animals have not shown evidence of an increased occurrence of fetal damage. That's all the information about Erenumab we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.